I'm Susan Zepeda, CEO of the Foundation for a Healthy Kentucky, and it's my pleasure to welcome you to the 2015 annual Howard L. Bost Health Policy Forum. Today's topic is building healthy places. On the back of your agenda, you'll see a brief memorial to Dr. Howard L. Bost, an early member of the Foundation's board and a health economist, perhaps best known for his role in designing the Medicare program for the nation and the Medicaid program here in Kentucky. Along the way, he helped with the formation of the Appalachian Regional Healthcare System and our own foundation. Dr. Bost understood better than most that policy change is lasting change. We honor him with our work today. We also thank our partners for today's forum, Kentucky Educational Television, better known as KET, Leadership Kentucky, the Pritchard Committee, Kentucky Medical Association, Kentucky Health Information Exchange, and the Health Enterprises Network. And thank you all for coming with us on this crucial journey. It's now my great pleasure to introduce the chair of the Foundation's Board of Directors, Mr. David Bolt. In his day job, David is Deputy Director of the Kentucky Primary Care Association. His career spans 45 years in healthcare in Kentucky, and I don't believe there's any part of this great state that David hasn't touched. Prior to joining KPCA, he was the Director of Network Management for WellCare of Kentucky. Previously, he was the CEO of a new community health center in Western Kentucky. He served as the COO of a 6-clinic system in northeastern Kentucky. He has experience in pretty much every aspect of health service delivery in our state and understands better than most that the keys to gaining and sustaining health often lie outside the clinic walls in our communities. Please welcome David Bolt.
Good morning, and welcome to Bowling Green. Forever in my mind will be burned the sight last night when I pulled into the parking lot. Many of you were there, and David Potasic pointing to the sky saying, "There it is, there it is." Unfortunately, it was a brief glimpse of the eclipse. My wife and son sent me notes last night wanting to know if I'd seen it, so this morning I clipped the photo out of Time magazine. I sent it to them and said this was on my phone. Now, I did not technically say that I took the picture. We won't go into the body search that Gary Usenich went through at the front desk. You're welcome, Gary. On behalf of the Board of Directors of the Foundation for Healthy Kentucky, I welcome you to our annual Bost Forum, named in honor of Dr. Howard Bost, a visionary in healthcare and healthcare reform. I want to thank the board members, Conference Planning Committee, and staff for pulling together what should be a thought-provoking session. I would ask our board members and staff and those who may have participated in the planning of this conference to rise for recognition. Come on, Chris, stand up. A few others, come on. A lot of shy, hardworking people. As a Kentuckian, I'm very proud of what we've done in healthcare over the last few years. As we did in education in 1990, we have set a course to improve the health of all Kentuckians. It is a strategic move to place improvement of the health of Kentuckians and move our Commonwealth forward. We need to thank our enlightened leadership, particularly Governor Steve Beshear, for pushing the envelope and realizing that good health is good business and one of the essential keystones for economic and social improvement. Strangely, that's a very capitalist idea. Dr. Bost, I'm sure, is sitting somewhere smiling with what has happened here in the last few years. Today we tried to move the needle again, as we did last year, with a focus on disruptive innovation, and many of you out there understand why I smile every time I hear that phrase. The foundation has gathered national experts and Kentucky innovators to discuss and tell their stories of ways to improve and move forward at the community level to build healthy places and to improve life in cities, towns, other places where we live and work. Much like Walt Kelly, the creator of the comic strip Pogo, we have discovered the enemy, and he is us. But in that discovery, we have also found the solution in ourselves. I think ultimately we will realize we cannot wait for policymakers to do for us until we get involved. We cannot wait for change to happen until we drive the needed changes. And that change begins with one person in one community at a time. For those of you traveling, safe journeys, and thank you. And now it is my distinct honor and privilege to introduce our keynote speaker, opening this learning and sharing event. The Honorable Crit Llewellyn is the 56th Lieutenant Governor of the Commonwealth of Kentucky. She is Kentucky proud, having been born and raised in Frankfort and attaining her college degree from Center College in Danville. She has dedicated her life to improving our state, both as an elected official and public servant. Her list of accolades include Distinguished Alumni at Center College, the National Excellence in Leadership Award, and Public Official of the Year honoree, among other numerous recognitions. She redefined the office of state auditor during her 2 terms as an elected official in that office. And actually, she won both times by a much greater margin than I've ever won as a mayor of the city of Lakeview Heights. They call me Landslide Bolt. Her positive effect on the Commonwealth has been evident in every aspect of her public service under 6 governors. Please join me in welcoming the Honorable Crit Llewellyn, Lieutenant Governor of the Commonwealth of Kentucky.
Thank you, David, and good morning, everyone. It's great to be here with you today in Bowling Green, and I see familiar faces from all across the state. David said I've worked with 6 governors. I'm actually on my 7th, but who's counting at this stage, right? It really is wonderful to be here with the Foundation for a Healthy Kentucky, our vital partner, as we all work together to think about how we can have a sustained effort to create a healthier Kentucky. I want to thank Susan for the remarkable leadership that you provide every day and all of the meetings and discussions that we've had where she's helped to inform our path, and we've discussed ways that we can collaborate and work together to keep our efforts moving forward. Community discussions such as these and understanding how all community sectors, from health to education to business, are connected to each other are critical to shaping Kentucky's public health policies. And, you know, they've asked me this morning to give some welcoming comments and help kick it off, but hope you will excuse me if I also preach a little bit, because Kentucky right now is at a defining moment in its goal to improve the health of our citizens. Today, for the first time, we have the tools to provide access to quality, affordable health care to all Kentuckians and to move that needle on some of our most persistent low health rankings. When Governor Beshear asked me to join his administration, I was eager to take on the job of Lieutenant Governor because of the opportunity to work with this governor in his effort to change those statistics and to improve the health of Kentuckians. The governor actually had this little set of talking points where he was going to talk me into being Lieutenant Governor, and he got about to number 2, and I said, "You can stop, I'm in." This is a great opportunity for me to come back into public service and to participate with this administration as his partner, because I believe that the greatest legacy of this administration, when the history books are written, will be a healthier Kentucky. And for that reason, I was intrigued and honored to be asked to join him. As leaders in health, business, education, and other community-focused areas, I know that you all in this room care about improving the health of our people. It's an interest that we all share. We wouldn't be in this room together this morning. For me, it became a very personal issue because I'm a colon cancer survivor. I was diagnosed with cancer 11 years ago. A year later, when I went back for my one-year checkup after surgery, a second unrelated cancer was found. I was treated with chemo and radiation. But in my case, a longstanding interest in public health policy collided in the most personal of ways with a life-threatening illness. And it really galvanized in me a sense that all of us who care about a healthier Kentucky have to think every day about how we can keep on a path that moves us toward that healthier population. When I was diagnosed with cancer, cancer had already claimed my mother, a brother, 2 aunts, an uncle, and since then, another brother. So for me, this commitment is somewhat of an emotional response, but it's also a very practical reality if you think about the public policy aspects of it and can remove the emotional, personal side of it, because the economic vitality and livability of every community in the Commonwealth is directly linked to improving the health of our citizens. Everybody in this room knows why better health is so important. It has tangible positive impacts, from fewer sick days to better school attendance and performance, more productive citizens in the workforce, but it also has those intangible impacts, including simply a higher quality of life for our people. And by providing access to preventive care, we all know that we can start to tackle health issues before they become life-threatening conditions and have higher costs to society. And for all those reasons, when the Affordable Care Act was passed in Washington, Governor Steve Beshear enthusiastically embraced the opportunity that it presented for Kentucky. Since then, more than 500,000 Kentuckians have signed up for health coverage through Connect, our health exchange, and 75% of them reported they had no insurance at the time. In fact, less than 2 weeks ago, the U.S. Census Bureau report came out that showed Kentucky had the biggest drop in the uninsured rate in the country from 2013 to 2014. We've now gone in Kentucky from 20.4% of our population being uninsured before the reforms to a number today of 8.5% of Kentuckians. It's really pretty remarkable when you think about those numbers. Now, thanks to that health coverage, Kentuckians tell us every day that they've finally gotten treatments and medications for chronic health issues. They've been screened for cancers and high blood pressure. They've had life-saving diagnoses or surgeries. And we can now see, at the beginning of this, it was aspirational what this might do for Kentucky. Now we can begin to see the data. We can actually begin to see the results. And we can see that that Kentuckians receiving preventive health services has risen dramatically since Medicaid expansion took effect in late 2013. In 2014, the number of individuals in the Medicaid program receiving preventive dental services went up 117%. Those screened for breast cancer increased by 110%. People receiving colorectal cancer screenings went up 108%. Cervical cancer screenings, 88%. Prostate screenings, 51%. In fact, there were dramatic increases in every critical screening category, in many cases more than doubling. Because of Governor Beshear's decision to adopt health care reforms, Kentuckians are not only receiving these critical services in record numbers and getting healthier, but it's also creating a positive economic impact. Even if you don't agree philosophically with the core fundamental principle of health reform, which is that everyone deserves access to health care, you can't argue with the numbers about the positive economic impacts for local hospitals, local communities, all medical service providers, both in terms of direct payments and also in the slashing of the cost of uncompensated care. Medicaid expansion has brought more than $2.2 billion into Kentucky, all across the Commonwealth, from January 2014 until now. In 2014 alone, that meant, for example, for our hospitals, just a few examples, $26.8 million new dollars for the Appalachian Regional Healthcare System, more than $13 million new dollars to the medical center here in Bowling Green, $9.6 million to the Pikeville Medical Center, $9 million to Baptist Health, Paducah, just to name a few of those examples. At the same time, the study that was recently funded by the Foundation for Healthy Kentucky found that uncompensated hospital care peaked in 2013, totaling about $300 million for Kentucky hospitals. But by the end of 2014, after a full year under the new health law, uncompensated hospital care had plunged from that $300 million high to under $60 million. So Kentucky's implementation of the reforms has been a remarkable success story, and one hailed as a national model. The governor has spoken all over the country. He's been interviewed by national media. Other states are asking us for advice about how we've moved in the direction that we've moved so successfully, especially with the implementation of Connect. You know, when the federal exchange was having so much difficulty, we were signing up people every single day successfully. So the governor and I will be doing everything in our power to ensure that Kentucky's health continues to improve right up until the last day of this administration. But we all know that improving the state's health is not a task that can be accomplished in months. No one knows that better than the Foundation for a Healthy Kentucky. Lasting health improvements will take years, and that means every Kentucky leader, whether in healthcare, business, education, or public service, has a vested interest in carrying forward this vision to create a healthier Kentucky. As has been mentioned, I have worked for 7 governors now in jobs from the bottom to the top. I started out in a mailroom in 1974 in a U.S. Senate campaign, and I've been state budget director. I've been at cabinet level posts for 15 years altogether. I've served as state finance secretary. I've served as secretary of the governor's cabinet, which is like chief operating officer, for 7 years under Governor Patton. And what I've seen time and again is that Kentucky fails to remain on course with a sustained commitment over time to successfully tackle our toughest challenges. We tend to take 3 steps forward and 4 steps back. Our public leaders get excited about the issue of the moment, and they look at funding and they look at policy change, and then they move to another focus. This is one that we can't afford to back up on. We can't afford to lose ground on this one. We've got to keep this momentum moving forward. The other problem I've seen through the years in my personal experience is not just this lack of sustained commitment to our tough challenges, it's that we tend to fail to connect the dots as public policy leaders and understand the critical linkages between health, economic development, education, crime, drug abuse, businesses' needs, environmental needs. All of these things are intrinsically linked, and we have to think about it that way when we're talking to people about the value of creating a healthier population. But too often, in my experience, we let political posturing derail our efforts, or we take the easy course when we're faced with difficult decisions. But right now in Kentucky, we have the opportunity to truly change the future of this state if we can cement these reforms in a way that has lasting and stable impact. And that will take everyone in this room working toward that goal. And not everyone in this room may represent a business or an organization or a provider who agrees with every aspect of healthcare reform or with every aspect of the Cabinet for Health Services implementation of the reform. But I know we all agree with the goal of a healthier Kentucky. And if we can stay committed to that overarching goal, and then we can debate the details as we move forward, then it has a chance of succeeding because all of us are committed to the overarching goals. Now, I know everyone in this room is well aware of Kentucky's dismal health rankings. I do a lot of speaking around the state, and I speak to a lot of groups who aren't familiar with these numbers, and they're always shocked. But we are still among the worst states in the nation for smoking, lung disease, heart disease, diabetes, obesity, and cancer deaths. And there has been little movement on any of those rankings for 25 years. We couldn't just keep doing it the way we've been doing it and expect those numbers to change. And my question that I keep coming back to is someone who has studied public policy and public leadership for a long time. How can any public leader sleep at night if they're not committed to these reforms, knowing that we have the highest mortality rate for cancer in America? How can anyone be against creating a healthier Kentucky? Improving the health of our citizens is linked to every other measure of the state's vitality and progress. And the good news is Kentucky's moving in the right direction on those other measures as well. Our unemployment rate right now in the state is 5.2%. That's down from 11% at the height of the recession just a few years ago. But the really good news is we have been better than the national average in unemployment for a full year. Normally, our state lags behind an economic recovery nationally after a recession. We're ahead of the curve. We are doing better than the national average. And last year, Kentucky led the nation in new economic development investment per capita. And we're on pace to pass that record this year. New investment, new jobs all across the state. In education, our student performance has improved, our college and career readiness has doubled, and our high school graduation rate now in Kentucky is at 86%. That's for a state that not too long ago had the highest level of adults without a high school diploma. And now we're graduating at the rate of 86% in our high schools. And we just launched Kentucky Wired, an initiative that will bring broadband, high-speed internet access to every corner of Kentucky. Another critical piece of the puzzle if you're looking at how all of these policy areas are linked in creating a brighter future for the state. Now, critics tell us we can't afford health care reform. We can't afford our share. When the state has to start paying a share of the Medicaid expansion and it ramps up to 10% of the total, we're not going to be able to afford it. Well, the truth is we can't afford not to move forward with this because it has such a vital role in our future. Before the decision was made to expand Medicaid, the governor, before he ever made the decision, contracted for an analysis by PricewaterhouseCoopers and the U of L Urban Studies Center. And then a second analysis was done, taking in the results of the first year of the reforms by Deloitte, again working with U of L. These are independent studies by nationally recognized analysts. And the latest study shows healthcare reform will result in a $30 billion economic impact over 8 years, and its benefits will far outweigh its costs. We've already documented over 12,000 jobs that have been created as providers expanded to deliver additional care. Those are direct healthcare jobs and the spin-off indirect jobs that are created from that economic impact. And there are so many benefits that you can't measure. You can't put a dollar figure on a higher quality of life. You can't put a dollar figure on a healthier and more competitive workforce that makes us able to create and attract quality jobs in this new economy. So it's critical for all of us who are committed to improving the health of our citizens to understand the facts as the merits of healthcare reform are debated. Now, we realize that no one administration, no one governor can shepherd the long process to ensure continuing improvements in Kentucky's collective health. We're about to wind down this administration, and we will leave office in December. That's why the other voices all across the state who care about this issue are so critical. And that's why the Foundation for a Healthy Kentucky is so important as an organization with credibility and a voice of reason and an organization that represents so many different aspects of the healthcare community. That's why that voice is so important moving forward. As part of our effort to broaden this discussion to the overarching goals that we ought to be focusing on, last year, Governor Beshear created Kentucky Health Now, which I chair as Lieutenant Governor, and it's a mechanism to track our progress in meeting 7 ambitious health goals over the next 5 years. And those goals include all of the things that you in this room care about, reducing Kentucky's rate of uninsured to less than 5%, and we're already at 8.5 from 20, so we'll meet that goal. Reducing Kentucky's smoking rate by 10%, the rate of obesity by 10%, cancer deaths by 10%, cardiovascular deaths by 10%, percent of children with untreated dental decay by 25%, and adult dental visits by 10%. Now, these are 5-year goals. Obviously, we need to keep working toward even lower numbers. The last goals deal with drug abuse and mental health, reducing deaths from drug overdose by 25%, and by 25% reducing the average number of poor mental health days of Kentuckians. Now, the first annual report of Kentucky Health Now was issued in March, and it reported progress on nearly every one of those goals. As I mentioned a minute ago, we've not moved the needle in this state in 25 years on those big measurements that track the health of our people. But now we can begin to see that movement. The exception, when we came out with that report in terms of progress against those goals, the exception was deaths from drug overdose, where we still saw an increase last year. But we're hopeful that the bipartisan comprehensive heroin legislation that the governor signed into law this year with support of both parties in the General Assembly will help in that regard as we try to bring the heroin scourge under control. So for the first time, and this goes back to my point about having a sustained commitment against our big challenges. We have a tough time as policymakers in Frankfurt setting these long-term goals that are measurable and then having a strategy to meet those goals because the political winds change, governors come and go, legislators come and go, but in the arena of health, we've got to stick with a strategic approach to bringing these numbers down, and we're doing that. Now, the Foundation for Healthy Kentucky has agreed to pick up that process of monitoring those measurements and tracking that data and making sure that we continue to disseminate to the public and to policymakers how we are progressing against those goals. And the Foundation is playing such a key role in other areas as well, meeting with other related groups and organizations who care about this issue, coordinating with the University of Louisville on monitoring our healthcare workforce issues, conducting analyses of the Medicaid expansion that provide an independent look at how it is moving forward. And we really appreciate so much that vital partnership role that the Foundation is playing. Because as administrations change, it's critical that the other advocates and partners and those who care about this issue pick up this ball and keep the voice heard on this issue. Another thing we took on as part of our Kentucky Health Now initiative was, and it was an enormous step really, for the state government workforce, the governor banned tobacco use, including e-cigarettes, on all state property. And that's a big step forward. We are the state's largest employer, and we have employees in every county of the state, and we have tens of thousands of employees across the state. So this policy will have far-reaching impact, and we hope it will encourage others to follow suit. And we continue to advocate for that statewide smoking ban. I see Representative Susan Westrom right here, and thank you for your leadership on that critical issue. You know, we didn't pass it last session. We worked hard on it, but we got it through the House. And for those of you who have been following this issue, that was a big step forward. We got enough support in the House of Representatives to pass it, which means next time that support is there, and we've got to move it to the next level and get successful support from the Senate. So I think if everyone keeps focused on that issue, it is moving forward. And I know it can be frustrating to watch that political and legislative process, but it will happen. It will happen. To continue our momentum, though, toward a healthier Kentucky, we need support from all of our allies, our health professionals, our community leaders, our businesses, our faith communities, our schools. We need everyone involved in this issue because health is everyone's issue. And of all the issues facing Kentucky, there is none more urgent. There is a direct link from poor health to every core challenge we face, whether that's poverty, unemployment, low educational attainment, substance abuse, crime. And better health is not a partisan issue. It's campaign season, but this issue should not be a political football. Cancer doesn't seek out Republicans or Democrats. Heart disease doesn't look for conservatives or liberals. If we can all work together with a sustained commitment to better health, we will turn around these tragic statistics in ways that will translate into a higher quality of life and better economic prosperity in every region of the Commonwealth of Kentucky. I challenge you to be our partners in that effort as we leave office and as this issue continues to be discussed and debated. And I hope that today's conference gives everyone a renewed sense of commitment to the role that you play and how you can take messages back to your communities to help keep this issue at the forefront and keep it moving forward. Thank you so much for the opportunity to be with you today. Thank you. Thank you. Thanks. Thank you.
Thank you so much, Lieutenant Governor Crit Llewellyn. I have a couple of housekeeping things to mention. Obviously, you all noticed how important it is to keep your cell phone on mute. We don't want you to turn it off, though, because we'd like you to tweet. At Healthy Kentucky, hashtag Bost 2015, that's B-O-S-T 2015. We hope you'll share with everybody who didn't make it here today the inspiring words that you hear throughout the day. Also, we're nearly paperless, and Wi-Fi is totally open here, so all you have to do is go to http://healthy-ky.org. Across the banner at the top, you'll see Bost Forum at the left. If you click on that, you'll get to conference materials. We hope you'll get to them and follow along. All the PowerPoints are there, all the useful links are there. And now, if you've never heard a TED-style talk, you're in for a treat with our next speakers. They come to us from all over America and right here in Kentucky, and they each have a different look at what it takes to make a healthy community. Our first presenter, Andy Dannenberg, holds appointments in urban planning and environmental health at the University of Washington, so he probably gets the prize for coming the furthest. Thank you, Andy. He'll speak about ways in which urban and rural land use and transportation planning contribute to the good or ill health of a community. Welcome, Andy.
Thank you. Good morning. This morning I'll be talking about the links between health and built environment and why this matters. If we look at what factors affect health, at the top of the pyramid you'll see education and clinical interventions, and these are very valuable parts of what we do in the healthcare system. But the amount of impact they have is relatively small. You treat one patient at a time. If we can do public health interventions and built environment interventions that affect many people, you get more bang for the buck. If you look down the pyramid to the fourth level, we're talking about changing the context in which people make their decisions. The very short version of health and built environment is you can educate, tell people to walk, but if you haven't built the physical infrastructure for a place for people to walk, that education has not much value. Here is a summary of the major interactions between community design and health, and I'll say a little more about each of them in the following slides. How we choose to use our land relates to obesity, physical activity, cardiovascular disease, water quantity and quality, access to healthy foods. How dependent we are on our automobiles affects air pollution, asthma, climate change, car crashes, pedestrian injuries. And it relates to social processes such as mental health, social capital, and environmental justice. Of the ones on the list, the physical activity is the area that people understand the most. It sort of jumps out at people. What determines physical activity is actually fairly obvious, but we have a good science to back pretty much everything I say. People are more likely to exercise if you make it easy. They're less likely if it's difficult. So if you have the trails and the parks and the gyms and the sidewalks and see other people out there, they're more likely to be out and be active. Less likely if it's too hard, if the weather's bad, they're too tired, they're not motivated, it's a long distance, they don't feel safe. Make it easy and convenient, people will do it. A lot of that has to do with community design. And these are schematics, but you'll find them in your own communities and in major cities and in suburbs. In the upper part is a very common type of suburban development, often called loop and lollipop, where we separate the houses from the schools, from the apartments, from shopping, from all the various destinations you might want to go to. And in fact, the only connection between destinations tends to be both a longer distance and, because you have to go out to that central artery, a not particularly safe route even if you did want to walk or bike it. In traditional neighborhoods, we have a much more grid-like system. Takes up the same physical amount of space, but the very fact that there is a grid-like system says that it is possible to get from that house to that mall, to that school, to your friend's house, or any of the other destinations you might want to go to. We also have a number of policies that don't make a lot of sense. So we will pass a policy for Americans with Disabilities Act and say we want a corner ramp on every corner. We'll pass another policy that says we want every property owner to build a segment of sidewalk in front of their property, and nothing that pulls the two together. And pictures like this are incredibly common. Sidewalks that go nowhere, little fragments, and corner ramps that just make no sense, and yet we allow that. We build parks, which can be a very critical place, parks and trails for physical activity. And yet some, such as the one on the left there, is designed only for people to drive to it rather than walk, compared to the one on the right where you can see housing in the background and people can walk out the door and use it. We get situations like this, and this actually conveys an important message, and that is that you want people to have the choice of how they spend their time and what they do. Creating that park or that trail does not guarantee its use. And some people will choose to have behavior like this, which is fine. What is important is that you've given them the opportunity to have a place where they can be physically active. We have various transportation designs that are virtually guaranteed to discourage physical activity. We can build a pole in the middle of a sidewalk, not clear which came first, the pole or the sidewalk. It doesn't really matter. You wouldn't do that in the middle of a street. Why do you do it in the middle of a sidewalk? We build clover leaves over interstates that are great for moving motor vehicles, but have no possibility of walking or biking, or even if theoretically there's some green space there, you couldn't get to it and you wouldn't want to even if you could. Or we can make some good choices. And this is in Charleston, South Carolina. They were replacing the Cooper River Bridge. You see the old bridge in the background before they tore it down, the new one there. Big fight over, do we put a walking and biking trail on the bridge? It's going to cost money. It's going to cost millions of dollars to add that walking and biking trail. The good guys won in the end. They put the walking, biking trail there. They are now fighting over how much parking to build at the ends of the bridge because it becomes such a popular destination. People are coming great distances just for the privilege of walking and biking on that trail. Obesity trends, I assume you've heard of in a number of settings. It's gotten a lot worse. From the 1990s up until the recent years, we went from where most of the country was 10 to 20% obese, and now it's mostly 20 to 30 and 35% obese. And Kentucky is among the states with high obesity rates. Some of the numbers here, you've been among the top 10 states for high obesity rates. 69% of adults, 33% of adolescents overweight or obese. Vast majority of both adults and middle school kids are not meeting physical activity guidelines. This has real costs. The prediction for 2018, $6 billion in healthcare costs for treating obesity. Some of the other topics on that list of how community design affects health. Air pollution. We had a natural experiment in Atlanta during the 1996 Olympics when traffic, which was routinely gridlocked in Atlanta, was predicted to get utterly unusable, and people actually stayed home. They were able to reduce peak morning traffic during the Olympics by 23%. Ozone levels went down 28%. Asthma emergency room visits for children went down 42% during the Olympics. The Olympics ended, the traffic went back up, the air pollution went back up, the asthma visits went right back up. Water quantity and quality greatly affected by how we build our environment. A lot of issues on environmental issues as well as financial issues of not having clean water. Injuries and deaths due to motor vehicles, an enormous problem. Injuries from motor vehicles are the leading cause of death among young people aged 1 to 34. We're talking in the range of 34,000 deaths a year and millions in non-fatal injuries and billions in costs. And a lot of this is how we design our roads. The photo in front of you there is Buford Highway in Atlanta, which is actually right outside the building at Centers for Disease Control where I used to work. And 7-lane highway, people try to cross it, has one of the highest pedestrian death rates in the state. Mental health also affected by how we build our environment. Depression can be relieved by physical activity and prevented by physical activity. Stress can be aggravated by long commutes. Attention deficit hyperactivity disorder can be affected by how much green space we have. And certain violent behaviors such as road rage is in part how we design our environment. Social capital, harder to measure but very important. It's the interactions in the community. It's defined as the social networking and civic engagement and trust and reciprocity. People who have long commutes in their car have less time to interact with each other. Some of the approaches that give you a healthier community go under the term smart growth or various other terms. Some of the features of them generally relate to higher density, more contiguous development, preserved green spaces, mixed land uses, walkable neighborhoods. You need roads. There is road construction, but balanced with other types of transportation alternatives. Heterogeneity architecturally, economically, racially. Development and capital investment is balanced between the central city and the periphery. And overall, what it needs is regional planning. What smart growth is and is not, it's not against cars and roads. We need cars and roads, but it's looking for more choices and a better balance in our transportation systems. It's not saying we don't want suburbs. We want, again, a better balance in vibrant cities and towns and suburbs. It's also not trying to tell people where to live or how to live, but having a good variety of housing choices. Just as one quick example of that, as empty nesters want to stay in the neighborhood where they are. If the only type of house is there is the large house they raise their children in, they have no way to stay in their neighborhood. And so that breaks social ties if they have to move elsewhere as they want to downsize. And smart growth is certainly not against growth. It is focused on how to do well-planned growth. So just to give an idea of how things can change, here's the kind of street that you might just pass through, not something you'd want to be in. And yet, as you start to change it, a little more density, a little more greenery, you can get it to a place, there's some life there. There's a reason you might want to be on a street like that. I want to spend a few minutes on healthy homes, what some of the features are. A healthy home, just briefly, is principle, it's clean, dry, ventilated, pest-free, safe, no contaminants, and well-maintained. What are some of the issues in substandard housing? Everything from asthma, respiratory infections, poisoning, neurologic disorders, depression, heart disease, injury, and cancer. A whole range of issues related to the quality of the housing. Some of the hazards that we find in poor quality homes, biologic agents, particularly mold, very common in many places, various toxins, older houses with lead and asbestos, and radon and carbon monoxide, issues of temperature extremes, crowding, injury hazards. And yet we know what some of the features are to have a healthy home. And so there's a whole literature out there as houses are built and designed and renovated of what kinds of features can be put into a home so that it's a healthy home that's promoting and helping the people living there to have healthier lives. I want to spend just a few minutes on health impact assessment. I'll talk more about that in the small sessions. It's an area I've been doing a lot of work in. I'm coming from the public health world, and as we looked at the links between built environment and health, we realized that the health professionals do not really have a way to talk to the planning professionals. If we want sidewalks, health professionals don't build sidewalks. The planning professionals, the architects, developers, city council, zoning commissions, they're the ones who make the decisions about how that built environment is done. Health impact assessment is intended as a tool to help that communication between the public health world and the planning world and the people who build the world around us. The vision is that planners and elected officials will want information on the potential health consequences of their projects and policies as part of their decision process. Local health officials will have this as a tool to convey that information to those decision makers. It will help public health be at the table and better decisions will be made. The colors didn't show up real well, but we now have health impact assessment in most states in the US. As of late 2014, around 300 or so have been done. There's been at least 3 in Kentucky that I've been able to find. A lot of it did start on the West Coast, which is where some things start, but it has really spread throughout most of the country, has had a number of health impact assessments. And one example of one done here in Kentucky was a health impact assessment done on the worksite wellness tax credit. And what they was conducted by the Department of Public Health in the state, and they looked at the effects of the tax credit on nutrition, physical activity, and obesity in the children of parents who were receiving the worksite wellness services, and also looked at social cohesion and jobs, and found that this tax credit would have favorable impacts and recommended that it be moved forward. Health impact assessments can be used in multiple ways. They both can help move forward ideas that are a good idea and do promote health, and they can help mitigate ideas that are not helpful to health and find ways to reduce what harm may be caused with it. I want to spend a few minutes on a few of the approaches that can be done in communities to get a healthier built environment. One is a policy called complete streets. And basically a complete street is saying cars aren't just for roads. A complete street is safe, comfortable, and convenient for travel by all legitimate users, be that cars, foot, bicycle, and transit. Louisville has a complete streets policy on the web. It sounded like Bowling Green either has one or has been working on one. These policies can pass, and then there is still additional work to get them actually implemented. But what it says is we look beyond just a road as a place to move cars, but look at the sidewalks, look at the bike lanes, look at transit where it's appropriate. And getting that broader complete streets policy as a guide to really all of your future development and redevelopment can make a big difference in the healthiness of your built environment. Another area that's relatively inexpensive and has had some substantial impacts is the concept of a shared use agreement. A lot of communities don't have enough green space, and it's relatively expensive to buy new green space. What's been found across the country is that there is a lot of green space in schools, and when one can get a shared use agreement between the school and the community, that space at the school can be used nights and weekends and summers when the school is not using it. And what the shared use agreement is, it takes care of those little details, the liability and the security and the maintenance and all those things that are seen as barriers, and yet we have model shared use agreements available on the web that make it so that a community then has that much more green space available for the whole community by sharing that space with the schools. So a relatively inexpensive way to expand green space in a community. Another favorite, because it has spread widely across the country, is the whole concept of rail to trail conversion. And it's using abandoned rail lines and turning them into trails. And in some cases, it's even rail with trail, where there's room that in some cases it maintains it so a rail could come back and still have room for the trail. I looked at the list for Kentucky, and you do have a number of rail trail conversions in Kentucky. One of the larger ones is the Dawkins line that goes from Johnson County to Magoffin County. Trust you all know where that is. But it sounded like it had been quite successful and really well used when that conversion was made. Another area that has really caught on both domestically and internationally is the concept of bike share programs, primarily in cities, but also on university campuses, as a way to encourage short biking trips. And there are many trips, a very large number of all trips under 2 miles are typically driven. And a lot of those could be converted to walking and biking trips if the facilities are there to make them convenient. Cincinnati has a bike sharing program that reaches into northern Kentucky. Louisville has a program that, what I found on the web, and you may have more information, is expected to begin sometime in the next year. So it is catching on here and is already reasonably common across many states in the country. The major messages are that community design and land use choices affect the health of the public. Those decisions are generally made on the local level. And for those of you who are health professionals and all of you are citizens of your community, you can influence the health of your community by becoming involved in those community planning decisions. Some of the things that you can do, and this works for both larger and smaller communities, so some of your rural areas will find this valuable as well, is find out first what is in your community. Inventory what's there. What are the community treasures? What do people care about? In some cases, it may be something that's been ignored for years, a historic site or a historic marker or whatever. And once you know where those treasures are and realize people may want to go to them, work on creating a walkable community, particularly a town center, a place where even if people need to drive into it because they live some distance, once they get there, let them get out of that car and then start walking around with multiple destinations. And there's a whole range of things that those destinations can be, coffee shops and stores and restaurants and a library and trees and town parks. We walked around Bowling Green downtown last night, and they've done a beautiful job of having some downtown parks that people want to be in. Part of what comes with space like that is the term activating public space. So you don't just want open space, you want something there that attracts people, and things like the interactive water feature that we saw last night, having farmers markets that I know you have, concerts and crafts fair and public sculpture, a whole range of different events will attract people and activate that space. There's a quote that nothing attracts people like other people. Once you have something there that's attractive, other people will want to be there as well, and the whole place moves forward. We have wrote a book on this a few years ago called Making Healthy Places. Website makinghealthyplaces.com has a lot more information on this. And let me just wrap up with a couple of other websites. With the bottom line message, community design choices can promote or harm human health. And the websites are one we put together when I was at CDC, cdc.gov/healthyplaces, and the Environmental Protection Agency has one on smart growth. Thank you.
Thank you so much, Andy. There's been a buzz lately about a new publication called Beyond the Four Walls: Why Community is Critical to Workforce Health. We're pleased to have brought to you today the author of that book, that publication, none other than Vera Ozeransky, is with us today. And I don't want to spend more time talking about her because I know you'd rather hear from her. So please welcome Vera.
Hi, everyone. It's my pleasure to be here today to share the findings from the past year's worth of research that was conducted at the Vitality Institute and published this summer in this report that's titled Beyond the Four Walls: Why Community is Critical to Workforce Health. And the research was actually funded by the Robert Wood Johnson Foundation to engage both businesses and community groups in effective, sustainable partnerships to promote population health. And our work had two components. So one, we wanted to use quantitative data to make the business case for why employers should be investing in the health of their communities. And so we used county health rankings data and sector data to link workforce and community health. And second, we gathered qualitative data through interviews with over 70 business and community groups to better understand existing employer-community partnerships for health promotion so that we could also demonstrate best practices and create guidelines for quality investments in community health promotion. Perfect. So I'd like to start with what is possible, and that's the case of Bath Iron Works, which is a ship manufacturer and one of the largest employers in Bath, Maine. So this company really understands the connection between workforce health and community health. And the company is actually partnered with LL Bean, which is another large employer in Bath, Maine, to fund a diabetes prevention program, not only for their workforce and their dependents, but also to open it to the larger community. So today I want to discuss three things. One, how can we transform the current landscape so that every employer looks like BIW and understands that workforce health promotion is insufficient without community health promotion? Second, while stories are incredibly powerful, businesses certainly use data to make investments, and so I'd like to share the data that we use to link workforce and community health. And finally, I want to talk about the business strategies that we identified that employers currently use to invest in the health of their communities, and that community groups can leverage and have leveraged to engage businesses in local health promotion. So to start with the data, what data are employers actually currently using to invest in workforce health? So we know that employers across the country are struggling to sustain the rising burden of healthcare costs. We know that the majority of chief financial officers and human resources professionals report employee healthcare costs as their #1 financial concern. So recently, Starbucks actually announced that they spent more money on employee healthcare costs than they do on coffee. And General Motors, Chrysler, and Ford reported that they spent more on employee healthcare costs than on the steel they use to make cars. So we also know the majority of employers, actually more than 90% of large employers, offer workplace health promotion programs, yet very few link these to the community, which is a major barrier to effective workplace health promotion programs. So what if all of these large employers across communities in the US extended those programs to their communities? What would our communities actually look like? So in order to see how we can have every employer do this, we wanted to look at these exceptional companies who are already doing this in their communities. And so one of the companies that we interviewed over the past year was General Electric, and I really appreciate the photo in the slide because to me it really shows that the company understands their most valuable resource, which is their workforce. So when we interviewed GE over the past year, Alan Gilbert told us the following. He said GE was spending upwards of $2 billion on healthcare costs. We knew we had to go outside of the workplace to create lasting change, and this meant partnering with stakeholders in Cincinnati, where we were spending a significant portion of our healthcare dollars and also have some of our largest manufacturing plants. So why is it that companies like BIW and GE understand that workplace health promotion is insufficient without community health promotion? Well, there's ample evidence to show us that behavioral, social, environmental factors in the community drive health outcomes. And the previous presentation covered this very well, but just to make it concrete, let's take the case of a welder at BIW. Let's say she has access to healthy, affordable foods in the BIW cafeteria. She has breaks during the day and perhaps even incentives from her employer to engage in physical activity, but she goes back to a community where she doesn't have access to healthy housing, she doesn't have access to healthy and affordable food, and she doesn't have green spaces to engage in physical activity. We certainly understand that these factors in the community will undermine any initiatives that are undertaken in the workplace. So go back to the data. We know that health varies tremendously across counties across the US. And a county in Mississippi can have obesity rates as high as nearly 40%, while a county in Colorado can have obesity rates as low as nearly 10%. Similarly, when I looked up county health rankings data for Kentucky, I saw that Boone County had a smoking prevalence of 18%, while Owsley County actually had the rate of double that. So the smoking prevalence in Owsley County was 41%. So for smoking, physical inactivity, diabetes, and death rates due to CVD. And we actually correlated that with sector employment across these counties. And we used the Robert Wood Johnson Foundation's County Health Rankings data as well as CDC data to do this. And so what we saw was that 4 employment sectors were more likely to be in counties with poor health. And so if these images look familiar, it's the same images that you saw on the previous slide that actually demonstrated workforces with higher health risks. So what does this tell us? It tells us that the majority of industries that are in counties with high health risks also employ a workforce that has higher health risk, clearly demonstrating that linkage between the health of the community and the health of the workforce. And to make this visual, we actually took the previous map, which I showed you, which demonstrates the variability in obesity rates across the country, and we overlaid that with the manufacturing sector prevalence. So here, pay attention to the red in the map on the right. So this shows counties with high prevalence of both manufacturing sector concentration and obesity. So and then the dark blue, actually, just for contrast purposes, shows counties with low prevalence of obesity and low prevalence of the manufacturing sector. So I'm just gonna pause here for a second just to make one thing clear. So, and I'm sure everyone in this room is familiar with this phrase, but correlation is certainly not causation, and this is absolutely true here. So our analyses were cross-sectional, so no way can we actually say that these sectors are causing the health outcomes in these communities, and further longitudinal research is certainly necessary to further examine these relationships so we can make more targeted interventions and scale up going forward. So in addition, our qualitative research identified 3 strategies that businesses are using to invest in the health of their communities. So these are strategic philanthropy, corporate social responsibility, and shared value. And the arrow on the bottom actually just shows how these strategies fit with the company's profit and loss statements. So strategic philanthropy is tax exempt and is certainly not part of the company's P&L, while shared value is certainly a part of the company's P&L as it's part of the company's core business strategy, right? So this is a term that many of you might be familiar with because it was coined by Michael Porter and Mark Kramer, but we also identified extended corporate health strategy as a critical yet often overlooked component of shared value. So while companies can create shared value by changing their products and their services that certainly improve the health of communities and improve the profitability of the company, they can also extend their corporate health strategy to the community to improve the health of the community with the aim of improving the health of their workforce and hence their productivity, the innovation of the company, and ultimately the profitability of the company. And so for each of these strategies, if you find our report online or email me and I'll get you a copy, there's specific case studies demonstrating how companies are implementing these strategies, as well as case studies of community groups who've leveraged these strategies to engage companies in local health promotion. And so to go back to the case of BIW, this company really understood that they needed to invest in the health of the community where their employees lived and worked. And they also understood the overlap between their employee population and the employee population of LL Bean. So many of the employees of BIW actually have spouses that work for LL Bean and vice versa. So the company is actually united to fund this DPP program, understanding the benefit it would have for the community, but also for the company. And BIW actually went as far as to calculate the savings they would accrue in the next 5 years from enrolling their employees in these DPP programs. And while they only launched the program in 2014, they've already seen the employees they've enrolled lose 7% of their body weight. So how do we actually transform this current landscape to get to where we want to be? So one, we certainly urge employers to extend their workplace health promotion efforts beyond the 4 walls into the community and to work with local stakeholders and to use local granular data. So it's so easy to just go to the Robert Wood Johnson County Health Rankings website and see what the risks in your community are, and certainly use that data to make strategic investments. We also identified a number of barriers to quality investments in community health, and I'll talk about those more in the breakout sessions just for time purposes. But one of these was really a lack of impact evaluation. So there was a lot of process evaluations, and this is certainly critical to know whether our programs are working, but we certainly need to advance the implementation science of private sector investment in community health to understand, 1, the impact it's having on the health of the communities, and 2, the impact it's having on business profitability so we could scale up going forward. And again, we urge employers to partner with local health departments, academic institutions, and even nonprofit hospitals who are already conducting the health assessments of their communities to do this. Finally, we really urge community groups to engage employers in investing beyond the four walls of the workplace. So one thing we found was the majority of community groups we interviewed, if they were working with employers, it was specifically on workplace health promotion. So if you're already working with employer on promoting the health of their workforce, you have the data to demonstrate the linkage between the health of their workforce and the health of their community, and to help them invest beyond the four walls. So just to end off, I like to end with a quote from Albert Einstein, who said that we cannot solve our problems with the same level of thinking that created them. And I think that applies so much in our case. I think, we have to suspend our biases and collaborate, because we're certainly not going to solve this chronic disease epidemic by working in silos. And I think cross-sector collaboration really provides us with win-win opportunities to improve population health, business profitability, and economic development. So thank you for your time. The full report is available on the Vitality Institute website. If you go to the community health page, you could download the entire report. Otherwise, if you'd like, you could just email me and I could send you a copy. But I'm more than happy to chat more afterwards. Thank you.
Thank you, Vera. Our next speaker demonstrates for us the way the city of Louisville came to understand that economic prosperity for the city depended on the educational level of the citizens of their community. And rather than just saying, woe is us, they took the matter in hand and developed a bold, innovative program that our next speaker, Mary Gwen Wheeler, is here to tell you all about. Please welcome Mary Gwen.
I'm going to be, if I stand to the side, can you still hear me? Is my mic on? Yes. Yes, great. Okay. Just wanted to make sure. So, when I was first asked to talk about education at a health conference, I was a little surprised. I'm not an expert on health, although I'm dangerously close to pretending to be one after having spent 4 years as the Secretary for Health and Family Services for Mayor Jerry Abramson's administration. And I did learn a few things about public health. I learned that it is more than medical care or access to health insurance. I did learn that there are many social determinants of health, that it includes all of those. And that in Robert Wood Johnson's county health rankings, education comprises about 10% of that impact in their health factors. But I do know a lot about education outcomes and how closely related they are to health. In fact, education and health are inextricably intertwined. The College Board has actually put together a paper called Education Pays that details a lot of those connections, the correlations, abundance of research out there that shows the correlations between health and education. College-educated people smoke less. They eat more fruits and vegetables. They exercise more, and they are less obese. More educated people live longer, and they're likely to have those social determinants that have better social determinants of health. The most powerful of these is perhaps income. Education tracks very closely with income. You may have seen some of those charts that show with each level of education attainment, their earnings, average earnings, go up. And in fact, over a lifetime, the difference between a high school grad and a college degree means $1 million in lifetime's earnings. They're also more likely to be employed, which means that they're more likely to have access to that health insurance or to those worksite wellness programs that Vera mentioned. The more educated you are, the more likely you are to live in one of those safer neighborhoods that has those green spaces that encourage physical activity, more likely to be near grocery stores that have healthy foods and cleaner air because you're less likely to be living near the factories. But there's also the reverse, that health impacts education. This is not rocket science. If you have an asthma attack as a kid, you don't go to school. Your attendance goes down. Academic performance is affected. Hungry and sleep-deprived kids are also less likely to have that regular attendance or be able to pay attention even when they do get to school and their academic performance goes down. We know that the stress that comes from living in those environments can actually affect brain development in the early years of growth. And as Vera said, though, correlation is not causality. So what does a group of people like you and us in this room do when we're trying to find those root causes? Where do we invest first? Where do we start? So many of the poor health outcomes and chronic diseases are really rooted in poverty. Poverty is a great place to start. That asthma attack that a kid might have is exacerbated for kids who live in the poorer neighborhoods because air quality might be worse. Poor families are more likely to be living in those violent neighborhoods or in places where they don't have access to transportation and might increase that stress I mentioned already. But what's one of the best ways to reduce poverty? Again, education. I mentioned that $1 million difference in earnings over a lifetime. Here in Kentucky, the Kentucky Center for Education and Workforce Statistics recently released a report that shows that 3 years after graduation, high school grads in Kentucky are still struggling just to meet the poverty line. Median wages for those graduates are about $11,500. In Louisville, the unemployment rate for a high school grad in 2013 was approaching 13%. At the same time, a college grad with that bachelor degree, unemployment was less than 2%. We know that education can break that cycle of poverty. It's also one of the main challenges to public health. Education is that great equalizer. It's providing hope, opportunity, a sense of agency. These are the kinds of connections that a group of leaders in Louisville across the sectors, from business, education, civic, government, community-based organizations, they recognized that these interconnections matter. They were moved by a study and analyses done by the Greater Louisville Project that compares Louisville to about 15 peer cities. And in education attainment, we were in the bottom tier. That created a sense of urgency when we're trying to dream bigger for our community and compete in the global economy. Greater Louisville Project also did an education pipeline analysis that showed that about 10,000 people are born every year in Louisville, and in that cohort, only about 2,500 will get that college degree, associates or higher. So this catalyzed the leaders, convened by Mayor Abramson at the time, to set a 10-year goal that we would move into that top tier of cities. That meant that we needed to have 50% of our citizens with a college degree, and that we signed the Greater Louisville Education Commitment that laid out objectives of how we would get there, shared values, and that overarching goal. It's a kind of mutual accountability agreement, and we approach the problem as a collaborative in a method that is increasingly being called collective impact. There's been some research done that there are about 5 conditions that are present when groups come together in this collective impact approach. The first is to have that common goal. For us, that 50% goal meant that we needed to add 55,000 degrees to our population, our working age population by the year 2020 to move into that top tier. It also meant having a second condition is a shared measurement system. So we annually report on progress toward that goal. Last week, the census came out. We're at 41.7%, increasing at our highest level ever, but not quite there yet, and not accelerating at the rate we need. And also looking at a number of other indicators, education indicators like graduation rate, college enrollment, and college graduation. A third condition is to have mutually aligned activities. And there's a phrase that sort of goes with that you have shared accountability but differentiated responsibility. Mayor Fisher, who embraced this project and this initiative, said it's really great to have that common goal that we all agree with, but what are each of you doing? And challenged each one of the founding organizations to set a goal and say how they were going to contribute to this movement. And reached out to the community as a whole with a Count Me In campaign, asking everyone to pledge, because how do we get 55,000 more degrees? 1 degree at a time. 2 other conditions: that you have constant communications and that you have a backbone organization that is keeping people convened, coming together, looking at the data, using the data not as a hammer but as a flashlight to understand where improvement could be made. And we then Mayor Fisher really looked at how successful we were being with this and said, let's not just look at this at the end of the pipeline where you're working with high school students and college students and adults and trying to get them to return and go to school, but he was moved also how important it was to work across the cradle to career pipeline, hearing the research that a return on investment of 7 to 1 on that public dollar is earned when you invest in early childhood education. The savings come in academic supports that are not needed later on, in social services, and even prison costs, because about 70% of inmates in our country are high school dropouts. But some of the leaders of that group said, well, wait, if we focus all the way across the pipeline, we might lose our momentum, really moving towards that 2020 goal. And as we were arguing, the mayor had put together a sort of framework that was cradle to career, and we were saying, but if you put too much emphasis here, we're not going to be able to really move adults at this end of the pipeline. And somebody said, but if you invest in that adult or the college student, you are in fact investing in the children. And she did this. And she said, look, these are the parents of these children. We must work across the pipeline. We're talking about families. And it's clear that this deep ecosystem, there are many, many interconnections. I mentioned the Greater Louisville Project, an organization that really believes that we must harness these interconnections to make progress. And I want to share with you a story that Ben Reno-Weber, the executive director of that, shared just a few days ago at what we called our Cradle to Career Summit. And he said that a health advisory board, maybe some of you in this room are on that, just came together to start working in this collaborative form. It was mentioned that the second most common reason for pediatric ER visits were respiratory issues. One of the major drivers of that are emissions from school buses and carpool lines. One of the potential mitigation strategies for that is tree canopy. And several communities around the country have focused on planting trees near schools. Both Humana and Brown-Forman, who were in the room, identified that as a major passion of a subset of their employees. Side note, air pollution and attending respiratory issues are substantial drivers of absenteeism, particularly for those young students, which is, again, a driver of student success. So in the space of 5 minutes, people passionate about the environment just became engaged in high school graduation. And employers who care about healthcare costs just became advocates of green space. That's the power of this kind of collaborative effort. So rather than arguing on where to invest, let's find and use this time to focus on those interconnections. An example for us has been when people were reaching out to help families fill out the earned income tax credit forms. We said, well, let's have them fill out the financial aid forms at the same time so that those families can access that college education that might actually increase the income that reduces the need for the EITC. When we're creating learning outcomes for biology, why not have the experiment be to grow some plants, maybe fresh fruits and vegetables, or at least vegetables you can grow in the school, and use them as part of the school lunch program, which in turn helps with making better food choices. So we all share this common vision of a healthier, more educated community. So today is our day to dream together, plan together, align our activities around that common goal for a healthy and educated community. Let's use the power of collective impact and approach our complex problems to solve them together. Thank you.
Thank you, Mary Gwen. You actually beautifully teed up our next and final TED-style talker of this morning. Margot Wooten from the Center for Science in the Public Interest has been interested for many, many years in the way the food policy environment shapes our choices. They have been working all the way from the federal, formerly Farm Bill and now Farm and Food Bill, down to things you can do in school districts and local communities. So without further ado, Margot.
Good morning. So I'm Margot Wooten, and I'm the Director of Nutrition Policy at a nonprofit organization based in Washington, D.C. called the Center for Science in the Public Interest. And I'm going to start with a confession this morning. I'm an addict. I'm a recovering addict, and my addiction is Candy Crush Saga. So according to the game developer King, I'm in good company. About 90 million people play Candy Crush. So how about in the audience? Anybody else ever play Candy Crush? How about some other game on your tablet, your phone, your computer? Any video game players from time to time? So Candy Crush works by you download this app, which is supposedly free. But the download is free, but that doesn't mean that playing the game is free. You get points by lining up candies. The more candies you line up in a row, the more points you get. I found the game pretty easy at first. Maybe about the first 20 levels. I was really cruising along, like clearing level after level. And you know, I thought I was a pretty good gamer for a middle-aged mom. You know, this was one of the first games that I was really playing regularly. It was fun, and I was just cruising level to level. And then it started to get tougher. I started needing to play the same level over and over again. Then I had to use up the gold. They give you some gold that comes with the game. Then I had to start using the gold. You can buy special candies, or you can get extra moves so that you can clear the next level. And I started needing to spend a little of the gold that they gave me. And then one night, I was playing in bed, I was tired, I had had a tough day, I was blowing off a little steam, and I spent money for the first time on the game. You know, I had used up all the gold that they had given me, and in order to clear this level, which I had played over and over again, I had to spend a little money. It wasn't a lot of money. You know, they give you these great package deals with like certain number of special candies and extra moves and the gold bars, and so I spent about $5. I thought, you know, okay, $5, that's not too much money. But that was not the last time that I spent money on the game. So I gave in to their marketing approach, which was to give me the free game, but then get me engaged in the game, get me liking it, getting me caring about getting to the next level, and then get me to spend money. So I got sucked in and spent a little money. So as I was playing, I realized that eating healthfully and watching what you eat in America today is a lot like playing Candy Crush. As the game draws us into spending more time and money, the food environment draws us into eating more calories than often we plan to eat, and oftentimes more calories than we really want to eat. The game prompts you to make moves that aren't always in your best interests. You know, it starts flashing the candies, encouraging you to move certain ways. And it also encourages you to play longer. You know, it keeps enticing you to try to keep playing, keep playing. Companies design food that's hard to resist. Cheetos are designed to dissolve in your mouth in a way that leads you to eat more and more. Even if you aren't hungry, an enticing food ad can get you up off the couch into the kitchen to get a snack or a soda. Or you go into the drugstore with good intentions and you walk out with a candy bar from the checkout. And as John Oliver recently said, Snickers only satisfies you for about 8 minutes, and then it makes you hate yourself for the rest of the day. So in the game, you're rewarded with stars, with happy smiling faces of the little characters in the game, and with words of praise, like here, you know, where it says tasty, or it says delightful, or good job. It regularly rewards you. The food system rewards us with the perfected crunch of a Dorito that is perfectly engineered by food scientists, with the afternoon boost of caffeine in your Coke, with a toy in a Happy Meal, or with a feeling that we got a deal, like when we get the double gulp instead of the big gulp at 7-Eleven. That inexplicable feeling and desire to get to the next level of Candy Crush is similar to how the food environment puts us in situations when we eat when we otherwise wouldn't. A candy bar from the checkout, a huge bucket of popcorn at the movie theater, a donut at a morning meeting when you've already had breakfast. How many of you usually have appetizers at home before dinner? Yet the menu at almost every chain restaurant, sit-down chain restaurant, is loaded with 1,000-calorie options. Getting to the next level of the game isn't important when you really think about it. But in the heat of that gaming moment, you're willing to pay to get there. It's like when you're not feeling hungry, but you catch a whiff of Cinnabon when you're in the airport or a shopping mall. And before you know it, you've purchased that unwanted or previously unwanted 800 calories of a sweet treat. You only get a limited number of moves to get to the next level of a game, just like we only get a limited number of calories if we want to maintain a healthy weight. In the game, you can get extra moves by just paying a small price. The price of eating more calories than we need is steeper. It's obesity, heart disease, diabetes, and cancer. It's high health care costs and disabilities. The game prompts you to play on. It keeps asserting, you know, you're so close to the next level, just play on for only 9 more bars of gold. Food advertising reassures us that we can fit in a splurge. After all, we deserve a break today. Or adds stress that the food will make us feel better. You know, have a Coke and a smile. It's just this one time. Pepsi literally tells us, live now. We can make up for that soda, that extra piece of pizza, or other treat later. Most people resist temptation regularly. We can't always be on high alert. So even if we resist temptation most of the time, that occasional indulgence really adds up because we're bombarded with so much marketing to eat more, and we're surrounded by food everywhere we go. It's especially hard to resist temptation when our willpower reserves are low, when we're tired, when we're stressed, when we're distracted. Like when we're shopping with our kids at the grocery store, rushing through an airport, or distractedly ordering lunch when we have other more pressing issues on our mind. Like my $5 of Candy Crush Gold, often the number of calories we overeat doesn't seem like much. It's a bagel at a morning meeting, a frappuccino on the way to work. It's a large instead of a small fry with lunch. But just as the makers of Candy Crush have built a very profitable business on a lot of people making tiny purchases, calories add up. Candy bars are pushed on us not only at supermarkets and convenience stores, but also at hardware stores, bed and bath, stationery supply, office supply stores, toy stores, clothing stores, and so many other retail stores. I mean, you can't go into Best Buy to buy printer cartridges without having to walk by a huge display of candy, which is there solely to get you to buy extra food that you weren't planning on purchasing. Soda is everywhere, from ballparks to bus stations to offices to shopping malls, movie theaters, restaurants. Even if you resist temptation most of the time, giving in occasionally is enough to tip the scales. The whole obesity epidemic, this whole huge epidemic that's facing this state and the country, is explained by an extra 100 calories per person per day. You play a game for fun, you eat for enjoyment, but companies, of course, are in it to make money. It feels like our food choices are solely a matter of personal choice, that we're in complete control of what we choose to eat. But companies study our every move to maximize profit. What their goal is to try to get us to buy more food in bigger portion sizes so that they can make more money. Marketers study human nature and hijack our biology to get us to buy more and eat more. The Center for Science and the Public Interest, where I work, we focus on nutrition policy as a way to ensure that people can make their own choices about what to eat. In addition to having the freedom to choose what you want to eat, we're also working to ensure that people have freedom from being pushed into eating extra calories they didn't really want or didn't plan to eat. What food is available, product formulations, package and portion size, price, where food is placed in retail stores as well as on menus, all affect how much food you buy and eat. And unfortunately, too many of these factors work against us and make it difficult for us to eat well and to maintain a healthy weight. It's not impossible to eat well in America today, but all too often, it's like swimming upstream. We need thoughtful approaches to improve access to healthy options at work, in restaurants, in schools, daycare, in vending machines, convenience stores, and other places where food is sold and served. Companies should use their marketing genius to support health rather than undermine it. And it's worked before. National labeling regulations and a number of state and local policies around the country have resulted in an 80% decrease in the amount of trans fat in the food supply. That's resulting in fewer deaths from heart disease, in less disability from heart disease and stroke, and in lower health care costs. This didn't come about just by wagging our finger at people and urging them to eat less trans fat. This came from a major shift in the way that companies make their products, reducing the amount of trans fat in the food supply dramatically. When Disney started offering healthier beverages and fruits and vegetables as the side dish that automatically came with children's meals, 2/3 of families stuck with those healthier defaults. So normally at many restaurants, when a family orders a kid's meal, they say, I'd like a hamburger kid's meal, and the restaurant automatically gives them a soda or fries. When Disney changed that around and automatically gave water, juice, and a side of fruit or vegetable, the families liked it. Most of the time, we're just distracted, we go with the flow, defaults work. and people ended up getting healthier meals for their kids. It was good for kids, and it was good for business. Google moved the M&Ms out of sight at their office snack station, so they provide free snacks to their employees. They still offered M&Ms, but they just moved them to a less visible location and put them in a container where you couldn't see the M&Ms. And employee calorie consumption decreased by 3 million calories over 7 weeks, just by changing how the snacks were presented. Stronger national standards for school lunches, which were really, which was started here in Kentucky, which had one of the strongest school nutrition programs, school nutrition standards in the country, and the rest of the country followed with the passage of the Healthy Hunger-Free Kids Act in 2010. These stronger national nutrition standards have led to children eating more fruits and vegetables and whole grains. And calorie labeling on menus at chain restaurants has resulted in companies reformulating what's on the menu and reducing calories for all people who eat in those restaurants. Money. Poor eating habits can cost you your life. After smoking, poor nutrition, unhealthy diets are the leading cause of early death, disability, and high health care costs. Candy Crush is only a game, but obesity is an epidemic. Supporting Americans' efforts to eat well and watch their weight is a pursuit that we can't afford to lose. Thank you.